Well, Saginaw historically was a lumber town. It was a big automotive town. I was born and raised in Saginaw, eventually left this area for 3 years to move out east for a residency in internal medicine. I got a job offer to come back to Saginaw and came back assuming it would be a very temporary job, and that was 25 years ago.
Good afternoon, Dr. Rivette's office.
I wanted to be a physician
Hi.
since I was probably 5 years old. I have no idea the draw, but I never wavered. It's all I ever wanted to do.
Today, Dr. Rivette operates a large internal medicine practice for Covenant HealthCare, treating children and grandchildren of her original patients.
Hi, hello, good to see you. I'm Dr. Rivette.
Hi, nice to meet you.
You too. I love the work that I do. I love the direct patient care that I do. Obviously, medicine in this country has changed pretty dramatically in ways I never imagined in the past 25 years.
Dr. Rivette was introduced to WellCentive's population health management solution by her physician organization, Covenant HealthCare. Skeptical at first, she is now a believer.
I use Epic, EMR, and WellCentive. And Covenant HealthCare also uses Epic. I believe we've had WellCentive for 2 or 3 years in the office, and it's very user-friendly.
WellCentive's unique advantages became apparent fairly quickly.
I did not see it at all as duplicate to what Epic was doing. We don't have that capability currently in Epic to do what WellCentive does.
You search for a patient's name, it brings up their vitals, it brings up their history. Everything you need is right on one page, and it's really nice to have.
The other functionality that we use is on a daily basis. My staff will go through my schedule and look at the alert icon in patients' charts in WellCentive.
On a normal day, I'll just search for a patient who's coming in the next day. They'll bring up their chart, and it'll flag me that they're due for, let's say, a mammogram screening. She hasn't had a mammogram in over 2 years. It'll flag me and alert me. I'll write it on my schedule, and then I will give that to Dr. Rivette.
I did have one patient that had been about 1.5 years since she had had a mammogram. She was contacted and did thank us for reminding her. Went and had her mammogram, and it ended up being breast cancer. Yeah, I believe that because she went in when she was, the cancer was found at early stages. She had a simple lumpectomy and radiation and is essentially cancer-free at this time.
Another key advantage to WellCentive is the ease with which it supports practice performance goals. For any insurer,
different insurers also have a percentage or a benchmark that they want us to achieve, and then we will get additional reimbursement. And as an example, a certain insurer may say, out of all of your female patients, I want you to have 80% of them get their mammograms, and we will reimburse you above and beyond your normal payment schedule. And instead of having to work individually with various insurers, WellCentive allows us to do that just for everyone, and it makes it much easier. If we didn't have WellCentive, we would have to go through each individual insurer that offers a performance payment system and use their individual programs to contact patients and get that data. It would be much more cumbersome, much more involved for the staff to have to do that.
but probably the most important advantage to WellCentive is its ability to prevent health problems before they occur.
And take a couple real deep breaths.
That not only lowers the cost of care, it improves the quality of care.
Because we have WellCentive, we are able to be much more proactive with preventative care. I think the safety is there, and I think it saves lives. On your mammogram, I did see a woman who I think was 50 and a half years old. Hadn't seen her for a couple of years. She did come in for her preventative, and right away the first alert in WellCentive was needs a screening colonoscopy. This particular woman really didn't want to have it done, really encouraged her to please get it done. She had it done and ended up having a very rare type of colon cancer. The early detection for her type of cancer, I'm sure, saved her life. She was completely asymptomatic, and I'm sure would have been until a very late stage of that cancer.
We potentially could have saved a life, by getting this test done. It makes me feel really good to know that we have that.
I think to be able to save someone's life or prevent a bad outcome is why, at least why I'm in medicine and why most healthcare workers do what they do. Wellcentive makes that much easier, and I think will allow us to continue to grow and be successful and have good outcomes in the future.